artificial intelligence in medical education, learning, and diagnostics. So, in this topic, we will be covering the various aspects of how the artificial intelligence plays an important role in medical education, not only medical education, but also the learning aspect and the diagnostic aspect, and which will benefit almost all the branches of medical education. I mean to say medicine, medical educators, surgery, the students, the faculty, and the auxiliary staff concerned with the whole medical education department. Now, it is not only about teaching, it is also about the clinical and the paraclinical aspects of artificial intelligence use in all these branches. So, as far as artificial intelligence is concerned, we are well aware of the fact that the artificial intelligence has got many uses. The artificial intelligence is no longer an option. Now it is a necessity. So we cannot do anything without AI in future. And what is important from a perspective of a learner, it is that you have to be well trained and having all the concepts about how the use of artificial intelligence can improve your behavior. I mean to say the learning behavior, the educative behavior, and the response to the various difficulties and challenges which we face. So, what is important first of all? First of all, it is important that in what aspects does the AI help you as a learner? So we take you to the example of a medical student of any class, of any branch. So let it be the first years of the medical student, or let it be a medical student who is in the final phases of his career, or it is a super specialty student. Now, he or she is preparing for any examination. Let it be an international examination like a USMLE, like a MRCP, like a Canadian board, like an Australian board, or any national level examination from an Indian perspective, like the NEET PG, like the fmge, or the INICT examination. And this student is preparing, and he has so many subjects to prepare. Now, taking an example of a student who is preparing for medical specialties, and in the medical specialties, he has to go through various specialties like cardiology, like neurology, like nephrology, like hepatology, like oncology, like hematology. And this student has got much of a preference towards certain subjects. But once he takes the examinations and he finds that he is not good in oncology, his performance is not good in oncology, or say, for example, hematology. So, what we are doing, we are giving him an opportunity, an individualized approach through AI. The AI generates his progress report, and in the progress report, what happens, he is found to be deficient in these two subjects, while as in the other two subjects, he is doing well. So, what we do through an AI generation is that we focus and channelize the student more towards the reading and other aspects of the two weak subjects. So, that is the AI, artificial intelligence. What it does, it identifies this student's strength, especially, and more important than his strength, the AI can give insights into the weakness, the areas of weakness of this student. And then, once the student's weakness is identified, we customize the learning paths so that the student does better ahead. So, what is important is that we improve and enhance engagement in these specialities. And with this, what happens? The academic outcomes of this student in any branch of medical education is improved. So that is one part, that there is a personalized approach which can be generated through AI, and we can just identify this student's behavioral study patterns and increase his awareness, increase his performance, and increase his academic outcomes in the relevant specialty. So that is one part. Now, what is the second part? Wherein AI, it is by a system of adaptive learning. And what does adaptive learning mean? It is not a static system, it is a dynamic system. And we have got intelligent tutoring systems which incorporate what we said in the phase one, that identify his weaknesses, his or high weaknesses. And what happens in the intelligent tutorial systems is that we have got a personalized guidance. So to this student, we give a personalized guidance and collect the feedback and adapting that feedback to the student's progress and learning. So we enhance their understanding and engagement in the relevant specialties. So we adapt the student's brain towards this type of learning, which is adaptive learning, because we identify that he is lacking. Say, for example, he's good in one liners and he's not good in, I mean to say, concept oriented questions. So we adapt his teaching pattern through an AI module that he needs more focus on clinical and integrative branches and teaching in that aspect. So we channelize his teaching towards a more clinical outcome because we already know that he's good in one-liner system or memory-based things. So adaptive learning, it is by virtue of AI that we generate this feedback, and which is not normally possible up till and unless we have got I mean to say a primitive type of a tutoring element. It is very impossible for a single educator to just gauge the performance of so many students. So we adapt this behavior as far as the student is concerned. Now, what is the additional role of AI in medical education? So previously we used to have patients bedside teaching, and it was limited by so many factors: the ability of a patient to cooperate, the time fraction, how many patients you could see, the timing of the patient, whether he was ready for that or not, and so many issues. And it was not possible for a student to just go and learn all the time. By virtue of virtual, I mean, say, AI driven teaching, you can do it 24 by 7 at your home, in your labs, anywhere where you have the facility. You do not need a patient to be there. AI driven simulated clinical scenarios are there, and you can just perform these scenarios. You can just work upon these scenarios at any simulation lab at your place if you have got a, I mean to say, a setup over there. So 24 by 7. And this is not only, I mean to say, one dimensional. You can do it two dimensional, you can do it three dimensional. And what this does, this virtual learning, virtual teaching, in addition to being 24 by 7, enhances your learning methodology. Because what you can do, you can just do it. Say, for example, I take you example of a fracture of a bone, and what you can do, you can just rotate the bone. You can see what the breach is, how the breach is, what has been the breach in the anterior direction, what has been breach in the posterior direction, what are the nerves in relation to that. By this virtue, the virtual AI driven simulation helps you improving your concepts. It is not only about one dimensional thing, it is not only about learning, it just provokes and keeps your mind more aware and sharpens your mind, sharpens your knowledge, sharpens your surgical orthopedic capability in this case, to just learn more. So this is the importance of AI driven virtual teaching. Now, second part is that AI can generate integrative teaching. That means a teacher may be very good in histology, but he may not be very good in pathology. But you have got a slide, a histopathological slide, and it is from orthopedic condition. Say, for example, having sarcoma in a child who presents with high fever, bone tenderness, pain, increased ASR. So, how does a teacher in anatomy correlate these things? He cannot do. Or how does a pathology teacher know the radiographic presentation of such a case of having sarcoma? And how do the basic sciences teachers integrate both? So, AI can integrate this in the form of a clinical scenario, clinical integration. That means AI can integrate the knowledge of anatomy, the knowledge of pathology, and knowledge of orthopedics, and give an integrative approach to the student in the form of a clinical scenario, generate a clinical scenario across all multiple medical specialities, and that's very important. So integrative AI-based approach is very important. I give this as a classical case of having sarcoma in case of a surgical condition. The same applies to multiple conditions. Say, for example, medicine, multiple myeloma. So multiple myeloma can present in an elderly with, anything skeletal metastasis anywhere in the brain, anywhere in the vertebra, high ASR, then other things like hypercalcemia. So you need to have an important concept about the lab values from pathology, about the clinical scenario presentation in case of medicine, and then how to diagnose as far as the radiological things are concerned, osteolytic lesions in the skull or in the vertebra. So that is, a mechanism of integrative teaching. So AI generated integrative teaching, it is awesome. It is awesome, and it is very helpful for a student. Now, number third is interactive. What does interactive mean? Usually in a classroom, it is a one-directional traffic from the teacher to the student. The student does not have that much, leniency to just go on and interact in a bilateral manner. It is unidirectional flow of information, and as far as our system is concerned, we do not allow students to interact much. But AI can be both ways. In fact, it can be multiple ways. It is just like convergent snaps in which you can get feedback from multiple students, and multiple students can just give their inputs. And what happens in interactive, there is the visual data connections which enrich the educational experience for students. So you can have a very interactive session as far as AI is concerned. So the virtual, integrative, and integrative, they are the three important features of AI as far as medical education is concerned. Now, I went again about the enhanced clinical training. And what does this mean? See, we have got these medical and the surgical specialities. So many surgical specialties: surgical endocrinology, plastic surgery, neurosurgery, robotics, which is coming fast, high. So, how can a general surgeon do robotic surgery? It is not possible for him to go and start doing things straight away. So for that, he needs a training. And AI comes to the rescue again. AI-driven robotic simulators, and stimulators in many cases. So simulation, AI-induced simulation is very important. You learn by AI simulators, and they provide a critical training, especially in case of, procedures which involve a lot of precision, a lot of skill, a lot of safety. I give an example of aneurysmal clipping. A patient presented with a severe headache, the worst headache of his or her life, and it was unfortunately diagnosed as a subarachnoid hemorrhage as a result of aneurysmal rupture in the anterior circulation, in the circle of Willis. So what do we do? So what we do, we just go for aneurysmal clipping, and it is a very skilled procedure, and it needs, a high level of precision, safety from a neurosurgeon to do this. But do neurosurgeons do it straight away? No. So what the current crop of new neurosurgeons can do, they can just use AI-driven robots, and they can learn from AI-driven robotic simulators, and that is how precision comes, that is how safety comes, that is how there are decreased mortalities and decreased morbidities in case of a surgical environment. So controlled, risk-free environment we had to give to the patients, because it's a question of patient's life. And these are very microsurgical procedures in which a high level of precision is needed. So AI can just do that by virtue of enhancing your clinical training and clinical skills. So that is very important. So the role of AI in enhanced clinical training is also there. Now, it is not only surgery and it is not only medicine. Now, there's a very important branch of medicine which is concerned with the radiology. And in radiology, you need to be, you need to have a pinpoint accuracy. You cannot deviate. You cannot have differential diagnosis. In many of the cases, you need to have a single diagnosis, whether it is there's a difference between a glioblastoma multiforme and a benign meningioma. You have to differentiate the things. There's a difference between a hydrated cyst in the brain, cysticercosis in the brain, and glioblastoma multiforme, or any other condition like toxoplasmosis. And so you have to be very precise as far as the diagnosis is concerned. I mean to say the 5-year survival rate, and in some cases the months survival rate differs. It's very hard to just have a lot of differential diagnosis and provide that to a physician. You have to be point specific as far as your precision in diagnosis is concerned. And imaging, radiological imaging needs to be having a very specific diagnosis. So AI technology in case of radiologists needs to be there, and it has enhanced, it has modified. They say that the radiologist's role is going. I won't completely agree with that, that a radiologist has no role, but surely AI-driven diagnostic accuracy for analyzing MRI scans, CT scans, PET scans, and the need for identifying the underlying pathology with precise speed, great speed and reliability, as well as, I mean to say, pinpoint accurate diagnosis is very, very essential for effective patient care and treatment decisions. Sometimes there are decisions to be made in split second, and these split second decisions are based on the radiological interpretations. AI has revolutionized radiology, and we know that, and we have to be. It is further improving. I tell you frankly, it is further improving, and maybe there is the role of a combination of a radiologist working with AI and a radiologist without knowledge of AI can be as good as useless ahead. So that's very important. The diagnostic accuracy by AI is a very important element as far as the diagnostics are concerned. So again, I go interpreting clinical data sets with AI. A human brain might be having a limited capacity to interpret clinical data. Now, these supercomputers, AI-induced technology, it empowers healthcare professionals by analyzing vast data. So it can get data from a community, small community. It can get data from a state. It can get data from a country. It can get a data from a continent. It can get a data from whole of the continents and just assemble together and just come to a conclusion by providing vast clinical data sets, by analyzing vast clinical data sets. That provides a better insight into the disease knowledge, the occurrence of the disease, the prognosis of the disease, the relative treatments, effective treatments of the disease in various regions, the drugs of choices of the diseases, and the complications of the diseases. So, by analyzing vital data sets, vast data sets, and in addition to that, just combining the diagnostic profiles of a single disease across vast data sets, that is very, very helpful. What happens? You come to a conclusion. The more the survey, the more the number of people in the data set, the more is your reliability, the more is your precision, the more is your sensitivity, the more is your specificity. So that is very important. Rather than having a data, having a study of 50 people, how good a study of 5,000 or 5 lakh people is. The study in 5 lakh people is far better than 5,000 people. The study in 5,000 people is far better than 500 people. So it is just like that. So analyzing vast data sets, which is not a possibility by a human brain by any means. So though this all is created by the human brain, that's the reality. But these are the important facts, importances, and the reliability which we will have on AI ahead. So you can see from everywhere data coming in, inflowing, and that helps in improving predictions. So we can predict the outcome of certain disease based on vast data sets. We can increase the patient outcomes in a positive manner by prediction, by accurate predictions. So what does vast data sets do? They enable us as physicians and clinicians to make accurate predictions and improve patient outcomes in case of any diseases. So across the spectrum, whether it is malaria, whether it is leishmaniasis, whether it's HIV, whether it's tuberculosis, we have got those vast data sets and they are very helpful. Now, AI application in medical care. Now, we do not always face these, I mean to say, slow progressive conditions. Take an example in medicine of a department like cardiology, emergency medicine, wherein there are certain conditions which are very acute, very severe. They need, I mean to say, immediate intervention. In cardiology, as an example, AI can enhance outcomes by what? By predicting the cardiac events. So we have got thromboembolic episodes, we have got MIs, we have got, I mean to say, arrhythmias, severe arrhythmias, VF, AF, so many types. We have got cardiological conditions, HOCM, wherein you can have instantaneous death. So that means causes of sudden cardiac death, say a condition like pulmonary thromboembolism. So these conditions, AI enhances in cardiopulmonary conditions the outcomes. How do they improve the outcomes? They improve the outcomes by predicting cardiac events. You can well predict by having a large data set, as I mentioned. And then non-invasively and managing heart failure. You are predicting that this patient will develop heart failure. We have seen in 1,000 patients that heart failure was the outcome from dash disease. So we are now aware from a vast data set, vast information that yeah, these patients land usually into heart failure, and then anticipating this heart failure, we can improve the outcome in this case. Ultimately, the benefit goes to the patient because we are revolutionizing the patient care with insights. We have got these insights now. We have got a predictive value, a positive predictive value. We can well predict, we can well anticipate. It is just like anticipation in case of Huntington's chorea, the trinucleotide repeat pattern. We can anticipate by analyzing the genetic segments. So, in a similar manner, it's not only about genetics, it is going deep into every branch of medicine. So, this thing, predicting the outcomes and ultimately for the patient's outcome, improving the patient's outcome, revolutionizing the patient care with actionable insights from large data sets. That is where the AI will be playing a very major, a huge role in future. So, in nutshell, you can see that as medical professionals, as educators, as people dealing with various branches of medicine, as people dealing with various branches of surgery, we have a responsibility to update ourselves to the max because we cannot remain outdated. You remain outdated and you are gone. So we have to embrace AI, artificial intelligence, I mean to say. And I guess that a brief talk of mine might have at least made you aware of the role of AI, which it will be playing in our future life as medicos. My credentials are given here. My contact is given here. My email ID is given here. I would just like to have a frank and critical analysis of my talk from you. I wish all of you best of health, and I hope that this brief talk of mine has had an effect on you as far as the role of AI in medical education, learning, and diagnostics is concerned. Thanks a lot.